Anxiety disorders.
Anxiety disorders are frequently treated using a variety of strategies and techniques aimed at reducing symptoms and developing coping mechanisms for anxiety triggers. The type of disorder a person has a lot to do with deciding which therapy strategy to adopt.
When a person is confronted with potentially troublesome or harmful conditions, anxiety is a regular occurrence. When a person senses an external threat, it is also felt. Chronic and illogical anxiety, on the other hand, might develop into anxiety disorder. Anxiety disorders are classified into several categories based on their causes or triggers.
Anxiety disorders in their most common forms.
Anxiety disorder with symptoms of generalized anxiety. This type of anxiety disorder is characterized by persistent anxiety that is frequently unfounded. People with generalized anxiety disorders, on the other hand, are unable to articulate the source of their anxiety. This sort of anxiety typically lasts 6 months and is more common in women. People with generalized anxiety disorder frequently fret and worry as a result of the anxiety's persistence. Heart palpitations, sleeplessness, migraines, and dizzy spells are all symptoms of this condition.
Phobia with a specific focus. A person with a specific phobia, unlike someone with generalized anxiety disorder, has a strong and often unreasonable fear of a single scenario or object. People with specific phobias show indicators of severe dread when exposed to the object or circumstance they fear, such as shivering, shortness of breath, heart palpitations, and nausea. Fears of heights, enclosed places, blood, and animals are all common particular phobias. A phobia sufferer's terror can be so intense that he or she will risk their safety merely to get out of the scenario.
Agoraphobia. Also known as panic disorder, panic disorders are marked by recurrent and often sudden panic attacks. Shaking, chest aches, disorientation, fear of losing control, and aversion to being alone are common symptoms. People who suffer from panic disorder are well aware that their fears are frequently baseless and irrational. This is why they avoid being alone and in public. People who are having a panic attack may lose control and injure themselves. A phobia sufferer's terror can be so intense that he or she will risk their safety merely to get out of the scenario.
Phobia against social situations. A person with social phobia, also known as social anxiety, may have symptoms that are comparable to those of panic disorder, especially in social circumstances. When a person with social phobia is the center of attention or in the company of a large group of people, whether strangers or not, shaking, dizziness, shortness of breath, and heart palpitations may occur.
Obsessive compulsive disorder. Anxiety is experienced by people with obsessive compulsive disorder as a result of a continuous obsession or notion. They tend to escape anxiety by engaging in repetitive acts or behaviors that help them ignore it. A person who is obsessive with cleanliness, for example, may become anxious at the sight of a vase that is slightly off-center. He or she will clean and organize things compulsively or without justification to avoid discomfort.
Post-traumatic stress illness. Following a stressful occurrence, a person may develop post-traumatic stress disorder. In his or her thoughts, he or she may relive the event, causing worry and anxiety. When a person with PTSD comes into contact with stimuli, any object, person, or situation associated with the traumatic incident, he or she may actually relive the event by sobbing excessively, panicking, or losing control. Insomnia and avoidant behavior are two minor signs. PTSD can appear quickly following a distressing event or years later.
It is critical to determine the type of anxiety condition a person has before seeking therapy and recovery. Techniques and approaches for helping a person cope with anxiety usually focus on not only symptom management but also coping mechanisms when exposed to triggers. Treatment and recovery for anxiety disorders can only begin after a comprehensive diagnosis.